The student needs to interact with you as an instructor and not as the enforcer of rules. In other words, you and the student need to be allies and not adversaries. Unfortunately, you may find you spend more time acting as an enforcer and not as an instructor, and it's a difficult role that you'll have to juggle in the process. But I can assure you, being a successful instructor carries with it a greater personal reward than being the successful enforcer. So how are you going to do all of this? Well, first let's take a look at an assessment rubric. And you know, rubric's a fancy word for a tool that's designed to standardize your assessment process. So it basically is your map for how you're going to be able to assess the student, or I should say multiple students, consistently. So if we look at professionalism, each box below a performance level would have a descriptor. You want to create the descriptors for what you feel to be the most important level for level 3, level 2, and level 1. So in this case, for professionalism, you know, a level 1 you might describe as, you know, the student is frequently disrespectful and inconsiderate, or does not accept responsibility for errors, or does not adhere to dress code. So if we look at the patient care skills, you want to define in there, what are you looking for? You know, they're there to be aware of the patient, support the patient emotionally. Did they make sure the patient was comfortable? Were they aware of what was going on with the patient? But what I would suggest is you search for any number of rubrics that are available. You know, you can get on the World Wide Web and also look at the resources with this video, and you know, gather together several examples, put together a rubric that contains what you like the best from each example.
My single greatest bit of advice to a new educator is to let them know that your students will rise to your expectations. Treat them with respect, and they'll show you the same. Try different ways of teaching ideas. You know, students like variety. But remember that you're not there for their entertainment. Let them help with the learning process.
And Nancy, in your situation, what kind of techniques do you recommend to overcome this?
Well, I think that there's a number of different things you can do, but I like that in doing this and evaluating performance, that we take it not as a personal perspective, but get other people's input. So what's the other staff think? And that also gives more credibility to it, and it might help with the nice guy and the harsh person, because it might balance it out. So I think a broad perspective is better from the clinical instructor side if they're going to be evaluating the performance.
We like to have monthly meetings with all the clinical instructors from all of our hospitals, and that way they can kind of socialize with each other, talk about similar problems, different problems, get opinions from other hospitals about how they do things, and it gives them a better feel for the college, because we from the college attend these meetings too, so it's more collegial.
Mm-hmm. Very good, very good. And do you serve food?
Sometimes we bring cookies.
One of the greatest things you can do to make for a positive meeting is to serve food or beverages. That's great.
This concludes the sample of this module. Thank you for your interest in the Clinical Instructor Academy series.